again, hi everyone. So this is Laura Pegram from NASDAQ. I'm one of the senior managers of drug user health over here and primarily lead up our drug user health work. In light of recent, the pandemic of COVID, right? Just to recap, we are reserving this time to really kind of talk through what we're hearing from different jurisdictions and in particular ways that health departments are finding to support or think creatively around supporting current drug user health efforts or syringe access programs. We're hoping to kind of just have this be a somewhat informal conversation and have folks be very mindful that if you are not speaking, to please mute yourself. Otherwise, we will have to, have people enter issues into the chat box, and it looks like we have a lot of callers, so that will not be feasible overall. So, really hoping to just kind of have a very informal conversation and, talk through some potential strategies and things that different jurisdictions have tried or thinking about trying in terms of general support. Just as a note before we get started, I don't know if folks are on their computers, but NASDAQ did yesterday or Wednesday, we put up a page specifically related to HIV, hepatitis, drug user health, and syringe access care on our website at nasdat.org. It's kind of front and center, you really can't miss it. And some of the suggestions that we've heard from other places or have been considering here. Okay, so some of the things that we've been considering, some of the things we've been considering are really making sure that there is enough funding available and emergency funds available for extra supplies for programs. Really thinking about at least 2 to 4 weeks potentially at the very, very least. In terms of supplies and service and adequate supplies, both syringes, cookers, and all the other things. Really trying to limit folks' potential contact with programs. Where possible, really looking into what it would look like for a health department to start to allow for, or local policies to allow for supporting mail-based delivery or delivery-based services, really loosening regulations that might prohibit a program from operating outside of a standalone storefront site. Really thinking about, loosening regulations that might prohibit mobile or outreach-based distribution. I think maybe the most important is really using this moment to loosen any kind of regulations around one-for-one exchange that really move towards a more negotiated exchange. In terms of making sure that syringe services programs have adequate access to hand sanitizer and to other, personal protective equipment, that's vitally important. And I'm going to go ahead and leave it there. Okay. All right, so we have a question about wondering what the legal issues are with mailing syringes. And, so mailing syringes is not illegal anywhere in the United States. You can purchase syringes legally off of Amazon.com. You can purchase syringes legally, and mail them and have them mail. And so, there are states that have partnered with online. There are states who have partnered with online distribution entities or who are distributing mail-based services on their own. And so there's certainly resources available for what that model could look like. And if that is of interest, we can create. We can connect folks, for anyone interested in that, with what that looks like. And it's also an issue of whether that is, sort of allowed within your current statute and within, allowed within sort of your regulations around what your syringe access looks like at the state level. Okay. All right. And yes, it's being noted. You can definitely raise your hand in the chat function, or sorry, on your attendee list, and we can call on you as well. So uh, uh, so Michael Dulitz says that we switched from office-based 1-for-1 plus to mobile and needs-based with promising results so far, which is great. And let's see, that person also used a Google Voice for people to text in for services, and we all get notified, which is another great option in terms of mobile delivery. Sounds like another jurisdiction moved from office-based to field-based, which is great. So that feels like the most common in general, switching from brick and mortar to delivery and meetup. Oh, yeah, it sounds like there's a general question about what types of phone services would be helpful for more rural-based programs to to receive supplies or to receive notifications when folks need supplies. And it sounds like Google Voice might be a good option. I know that some programs use Signal as well. So it sounds like several programs have been designated as running as essential and within health departments and as essential, determined as essential by health departments. Several programs look like they are moving towards pre-packaging kits related to, sort of 30 syringes and materials based on individual use and need. From someone at a health department, it sounds like there's experiencing some challenges trying to keep in touch with the actual SSPs themselves because they're moving outside of their brick and mortar overall. And yeah, I mean, I think that brings up a really good point in terms of communication and brings up a really good point in terms of, how to, either keep track or be in better communication with the actual services that we're hoping to support. There is a question about 12-step program meetings, but many are going to Zoom. So it sounds like in that, from this comment, now that I read the whole thing, sounds like that since many 12-step meetings are going to Zoom, they're also being considered as sort of vital or essential services. Again, let's see. Okay. There's a general question about since we've had to close our clinic and mobile here in Richmond, doing mailing might be too expensive, challenging. Is anyone doing delivery and able to navigate social distancing and clients, staff? I think that this is where some of the recommendations, particularly around making sure that clients and staff have access to adequate PPE and hand sanitizer and extra supplies, and that really recognizing that need is, again, very vital. And from California, in response to the mailing question, just want to note that that in California, we're partnering with CDC to fund next harm reduction to do mail and web-based harm reduction statewide. Our state board of pharmacy agreed that syringes mailed from authorized SSPs don't fall under their regular purview. State by state rules may vary, but that's the story here. And that is the story in all of the states that I know of that are talking about doing that is that since it comes from an authorized syringe access program, that it would be really vital that it would be considered the same as walking away from that program with supplies. A question: what is the Google app? It's called Google Voice, which is it's an app where you can create um, another phone number on top of your regular phone number. It can all ping to the same phone. Um, So it sounds like several programs are, this is a health department, looks like health department run programs that have somewhat limited hours, and they're moving to sort of what I would think of as more of like a food truck sort of model where people don't come into the actual services, but they kind of come to the side door and there's a handoff, which feels important. Uh, right now, it sounds like each of those programs has limited the SSP staff, which is tricky, I think. I mean, I think maybe essential, but, for some situations, but also could be quite tricky. Like, what if that staff actually gets ill or is unable to be there? So, important consideration. Uh, So there's a request for online support groups or online recovery communities. Does anyone have any list of those that could be shared out? And I know of a list that recently went out, and I think it's going to be vitally important for programs and health departments to consider creating more local meetings or meetings using multiple online apps at this point, because there's typically meeting limits overall, and it would and sometimes the meeting will be too slow for it to be adequate to share out, but we can certainly look into that from our side over here as well. There's a question in general about naloxone availability and if folks are providing extra doses, and a suggestion to moving and changing regulations to allow for secondary and peer exchange. And I'm curious if anyone has other reflections on how much naloxone folks are looking towards. I mean, I think the general rule of thumb would be towards giving out as much as the person feels that they might need, or using within their community. So it's the moment of trusting your client in that second there. So there's a question if anyone has tips for proper personal protective equipment for outreach or mobile SSPs in order to be able to provide services. Is there also a guideline for when mobile SSPs should be closed due to COVID? Right now, I would say that all the basic precautions are very are the same for a mobile SSP as opposed to a standalone. I mean, really thinking about increasing disinfection and antiseptic, making sure everything is being wiped down with more of a frequency, but also maybe limiting how much of the services actually happen within the mobile SSP versus from the outside. Sounds like DC Department of Health is developing a one-pager to share with community members about this in particular, so that's great news. Let's see. So it sounds like in Alameda County, the Alameda County Public Health Department in Oakland issued letters to both of our certain services programs there that they provide essential services to support them in their ongoing operations during the COVID response, which will allow them to obviously stay open and to continue to provide services throughout, regardless of the travel stay-at-home shelter ban there. So in terms of the question about the recovery or mutual aid groups. Let's see, we got a notice that there's an app that's called Connections. It's an option for people to assist in tracking the recovery groups. Yeah, another question about when mobile syringe, access doesn't make sense as much as it should, or might be more harmful than helpful. And I think general guidelines, are similar for this as to most medical services. Is that if you are not feeling well or have a few, have any indication of symptoms, then you should not be. And I think it brings up a point that I and a lot of national partners have really been talking through is ensuring that as these are really vital and essential services, that we have many different potential people who are available to staff, and really thinking strategically about staffing and staffing for sort of the long haul, about to make sure that the programs are adequately staffed there. There's a request to definitely include some information or create a fact sheet specifically around overdose and not using when other people are around, and hopefully trying to find ways to prevent, to increase strategies to keep people using safely when we are encouraging social distancing, which I think is great. So the DC one pager is going to educate the people who inject the community of folks who use drugs about COVID-19 and how to keep staff safe. Most providers are still operating, at least the SSP services, but brick and mortar are working reduced hours or closed entirely. And there are those great fact sheets that were put out by Higher Ground Harm Reduction and the National Harm Reduction Coalition, as well as Vital Strategies, each one looking at COVID and people who use drugs, and COVID and the programs themselves. Hope, I think, after this call and some other research and maybe smaller focus groups, we're really going to hopefully be putting out some suggestions for health departments and how you all can potentially support sort of a complement to those. So someone mentions that their organization is not able to provide syringes mobily due to restrictions about site approval, but they're looking towards if dropping supplies for secondary distribution and would be possible. And I think that this is a great example that a role that either a health department or a publicly funded agency could really have in terms of impact is looking at, are there ways that we can reduce those restrictions right now? Because this is the time to be having that conversation. Obviously, this is practice. So we need to make sure that we are looking at those policies that are preventing what will keep everyone the safest, and doing the most to figure out how to overturn them or get them waived for the time being. So it sounds like a lot of folks have been able to waive those policies. And yeah, someone else points out that especially in terms of providing limited or mobile services, you're really, when we're looking at social distancing, we're looking at 6 feet, and that's for a sustained period of time. So really keeping the interactions as short as possible, and considering services that might take more time, and cutting certain services or limiting certain services or changing the ways that they are employed would be useful. And Harm Reduction Coalition, Vital Strategies, Higher Ground Harm Reduction, and Reynolds Strategies have all created a 1G for SSPs and for drug users. So someone asked if there is the potential for sort of kiosks or vending machines for for syringe access programs, and those do exist. And we can, if this person would like to reach out, I can certainly give more information around those. In terms of a response to the overdose prevention statement, there is a phone service that's called Never Use Alone, and I believe there's an app as well at the 1-800 number, 1-800-484-3731, and it's to have someone basically be a volunteer, be on the phone while you're using, so that if something happens, that person can call 911. Let's see. Oh yes. And thank you, Marjorie Katz, for providing the link, and we can certainly make sure that that's included, and has been, yep, great, and has been, will be included in terms of resources that we update to our page as well. It sounds like several programs that have left comments are coordinating with volunteers and staff to create, again, prepackaged kits, and that's a suggestion from their health department, which is great. And right now, that's the end of the chat. So, like that, what's in the chat box. What I might try is to open up by region, or if anyone has any has raised their hand at all, I'd be glad to try opening up the services here, the chat here for any discussion, or if folks have any other responses. Oh, it's a bit more, hold on. So there's a question about, is there anything health departments can do to make sure MAT programs know about the new guidance allowing take home, and that they have practices to ensure proper social distancing, etc. We are hearing some concerns from community members. Yeah, and I think that this is, really some of the hope for us in creating this one pager is to really talk about what are those different strategies, making sure that service providers know that there is potential for anywhere from 14 days to 28 days for opiate treatment for both methadone and buprenorphine, and making sure that folks know about those new restrictions that have been waived, and certainly want to include that sort of policy level change that has been sort of policies that have been altered or affected and waived in order to get better access to services overall. Yeah, and then the second part of that about practices to ensure that there's proper social distancing, and I think that's included in the general, the two one-pagers that HRC and Vital Strategies and Higher Ground Harm Reduction all put out last week. I do think that this next week we will see several national partners really looking together about what are sort of our thinking about what are potential policy considerations and asks, things that feel really, really vital in terms of actually providing services and making sure that that everyone's covered on, in terms of being able to provide services. Yeah. Let's see. Okay. I do think that, it would be, it's obviously this is an emergency and nobody, really likes the phrase never waste an emergency, but I do think that this is an opportunity to really talk through, how one for one doesn't make sense in general and certainly doesn't make sense now. So trying to get as many policies waived or loosened, that are currently restrictive as possible. Also thinking about specifically any policies that might limit someone's ability from to move to mobile, to move to outside of a brick and mortar response is really, really vital. So give it a couple more minutes. I will say I have heard from several health departments who have been trying some different things, really trying to coordinate with local law enforcement officials to make sure that they are aware that the syringe access is considered essential in their jurisdiction, and hopefully getting law enforcement support in that way. And then also, I think the other real recommendation that I would like to see, and that I would suggest to really work on, especially if you work in a public agency, either a health department or for a behavioral health agency in your state, is really thinking about waiving or relaxing reporting requirements from programs that we know are stressed and likely running out of supply, or struggling with supplies and underfunded. So thinking about, loosening or waiving reporting requirements in this time, and really making sure that your programs know that they are able to, that you are going to continue funding them in meaningful ways, and maybe even thinking about not having applications due, but thinking about continuation of funds without an application overall. So that would be another potential way that programs could support, or health departments could support programs. Let's see. There's a good point brought up here about the role health departments or other agencies could play in terms of, how mental health challenges could arise, and increasing mental health supports within the community, and also maybe offering those or creating those, for program participants, or more generally for your communities. It seems like a great space to be able to play an important role there would be to help create some of those, thinking about hotlines or suicide prevention hotlines, domestic violence prevention hotlines. I think that's a really great recommendation, especially given the role of health departments, right? And yes, certainly a recommendation from states that are a little bit more mired in the public health response at this moment, or have more higher caseloads overall. There's a recommendation that folks in states not experiencing high case volume to clearly start the discussion earlier the better, and it's been quite challenging for them. It's a great question from health departments, from the health department staff, about any additional funds that NASDAT is aware of for supplies, additional SSP supplies or supplies related to COVID-19. Thinking about mobile hand washing stations, collapsible water jugs with spigots, gloves. And as of right now, I know that many of the federal funds, the HIV prevention funds and hepatitis funds, can be shifted towards, to some degree, towards COVID response. And I know that our federal agencies are developing and releasing guidance about that as we speak, that several health departments, state health departments, received some form of guidance in the last week or so. So yeah, I mean, there's a real recognition that programs would like to increase the amount of supplies, syringes, smoking kits, safer snorting kits, and general injection supplies, but can't afford these out of pocket. So really hoping that health departments might be able to pick up that slack, and offer emergency funding or increased funding for actual supplies themselves. And I agree, it's a big one. Yeah, I mean, I think that there are certainly increased funds that are being available that are being used directed towards COVID response. So I think a role for health departments or state or local agencies would really be to making the case about why shifting some of those funds and directing some of those funds towards actual supplies for programs and supplies related to, thermometers, gloves, personal protective equipment, etc., would be well placed within syringe access programs as well as other healthcare services, is going to be vitally important. Health departments do have, the ability to try and, really, share input from programs on the ground and how to more meaningfully support them to lawmakers. And so I think that is a vital role overall. Yes, so there is still a ban, a federal ban on using federal dollars for the actual syringes and cookers. That is still true and has not been lifted. Right now, we have been doing, I mean, before COVID, have been doing a lot of federal advocacy around that, but that is true. That is still lifted. Or, I'm sorry, that is still in place. It is not lifted. But state level funds and state level emergency funds could be used for those supplies. I'm curious, are there any states that are present on the call who have increased supplies and funding towards their programs? And I agree, yes. I think one of the asks for us federally at this point in light of COVID is a lift on the ban to use federal money for syringes and cookers. I think that that's a really obvious ask and one that we are crafting language for right now, or discussing internally right now. So,
stop now. Can stop.
Oh, let's see. All right. I mean, I think that these are the real opportunity moments, thinking about, what are those suggestions? So lifting the funding, the ban language, and also, I've been thinking about, what would it take to increase the amount that DEA X waivers are, for other types of opioid treatment, especially in light of people using drugs. And I would assume what will become over a bit of time might be increasingly unstable drug market, and people not having access to supplies. I'm sorry, not supplies, actual drugs that they are used to. So thinking broadly about those, we'd love any suggestions that folks have for us at NASDAQ to play a role in that way, with more federal asks. So let's see, we are still taking any chat for I'll stay on here for as long as folks want to offer up any chat, but I'm curious if anyone who is still on the call, if anyone who's still on the call is from a health department or a state agency and has redirected any funds or have any increased strategies for ways that they have been trying to support programs. I'll say from one health department, I think it's Seattle, King County. I know that in general, folks were that the health department worked with several motels to basically pre-purchase hotel rooms and large blocks of rooms for folks who were identified as being in need of quarantine overall, and specifically looking at doing some of that screening with SSPs within SSPs. So that was a space where I felt like that was a good thing to kind of get out ahead of and have in line overall. Let's see. So it looks like folks in Colorado are looking towards. They have not redirected any funds yet, but are looking at our state general funds to see if specific emergency asks can be made. And I think that would be incredibly smart. Yep, health departments, have certainly been increasing language around needs-based supplies, which is great in Kentucky. And I think that is probably the most immediate ask for sure, and trying to remove any regulations or restrictions on that. Yes, so this call, we're going to synthesize a lot of this information and figure out the best way to put it out publicly, either on the NASDAQ page or in sort of a one-pager or two-pager about the ways that health departments could support syringe access programs and what is currently happening and working. So yes, we are on it. It also sounds like in Colorado, states are allowing syringe access programs to really bulk order syringes through the state level ordering program at this time, which sounds like a change, so that's great. And there's a good reminder from folks in the hepatitis community, really making sure that we are not leaving hepatitis out and other infectious vaccine preventable diseases like hepatitis A, specifically, especially for people who use drugs, as agencies are diverting a lot of resources towards COVID response, really making sure that we are making sure that all essential services are covered, and remembering that this is about comprehensive health as well. So trying to really be aware of where funds are being shifted from for COVID response is vital. And that is seconded by folks in Colorado, that the response is already seeing some impacts in terms of not having enough staff or enough resources to work towards making sure that vaccines are available for people who use drugs and others. And it sounds like both Colorado and King County have seen recent hepatitis A infection increases as what is assumed a shift in resources, which is frightening. Outbreaks within outbreaks is not what we want to see in this moment. Another question, I guess, that I would like to pose to anyone who's on the call is really considerations about supply chain, and if there have been any indications from the people your suppliers for syringes or other materials about potential shortfalls or delays. And yes, I appreciate this comment coming, about whatever we create to be ensured to include something about self-care and secondary trauma exposure for SSP staff and volunteers. Yes, I think that certainly fits within this, and also thinking about the different ways that health departments can play a role in terms of creating resources or disseminating resources for vital staff, including SSP staff. It sounds like services that are being offered at an HIV clinic, and I'm not sure where, have moved to basically outreach services and there's an open video chatting for folks to reach out and chime into, which is a good option if there is a particular staff who need to be more office based. That's a great role, and also a great way to just kind of keep open that communication. So it sounds like yes, in terms of sanitizing wipes, hand sanitizer, all of that is current. And sounds like they've been given a message that that is on back order from Mason, which is never good news, and I think it's on back order in general across the country at this point. But another space where state and federal agencies can, and local agencies can have some can play a role in terms of collecting those types of shortages and gaps, and really finding strategic ways and creative ways to make sure programs have what they need. Thank you. There's a resource that was shared from the Minnesota Department of Health about syringe access or guidance for SSPs and trauma. And it sounds like programs in Kentucky have also experienced shortages. Sounds like several health departments are exploring mailing out naloxone as well as other supplies to consumers, and there are definitely options to be exploring it, and resources out there and available, even models of nonprofits who do that specifically and have partnered with states to do that. So the health department can do that within state. Let's see. Any other chat in this moment? We'll give just a couple more minutes here. So I think another thing that I've heard from one program in particular was really looking at whether it was possible to make sure that there were mobile hand washing stations in places where there was a high density of folks who are unstably housed or maybe using in public. That felt like a very useful intervention in general, but especially in this time. Oh, okay. Let's see. Oh, we got a couple in here. Sorry, I'm falling behind. Sorry. Okay, so Jen Plum, I'm not sure. Oh, here we go. So a question from folks in Utah is how does an organization work on the essential services designation? That's a really good question, and one that has come up in a couple different times this last week as folks are strategizing ways to really get that done if it's not automatically done. So I think that, I did a little bit of research in general this morning about what is considered essential services under the Emergency Services Provision Act. I was researching the language from 2018. That was the most recent update. And it seems that, a federal emergency is declared when there is extra funds that are federally dedicated towards response. So this would, we've already done that. We passed that bar already, and that the basic criteria for what is an essential service is either someone who is working towards restoring, thinking about like power supply and electricity, things like that, or the second category is, you know, a public agency, a nonprofit, and then there's one other who is providing services that are deemed, that are services that are in support of addressing the emergency. So I certainly think that if you, as a service provider, someone who's running a syringe access program, really made it clear that the people you are serving are getting access to increased resources and services related to COVID and to protecting their overall health, that it seems to me that that syringe access programs might automatically fall into that category. I think one thing that we can do after this call is really reach out to some folks who are lawyers to see what, if there is a distinct process that would have to happen at a state level, or if specific language would be useful. So I think that that feels very, very possible overall, and we can follow back up on that. It does sound like several programs are looking, also suggesting, you know, again, information on how to bleach syringes for folks who know that there are going to be a shortage. It's not obviously the best, but I do think that it's an important, you know, tool in everyone's toolkit. So. Yeah, I mean, I think the reiteration of public hand washing stations and sort of sanitation, you know, shower rooms or hand washing rooms would be is certainly an avenue that it sounds like some health departments are looking towards, especially as as McDonald's and public services like you know, libraries are closing. I mean, I think that the more that we can have hand washing stations out there, the better. There's a lot of conversation around this, so really considering adding those would be, you know, to mobile outreach or to mobile services or a mobile site would be helpful. It sounds like we'll collect all these resources that are being shared, but a resource that might be relevant for those who do outreach and or are houseless, from Street Medicine Institute. And so we'll make sure that that is posted on our NASDAQ webpage. And yeah, a question about whether it might be possible for pharmacies to loosen restrictions on syringes at this time. And as you know, I think that that is always possible, and in general might be a great ask from a health department or a city or state agency to really convey the importance of having multiple access points for people who use drugs at this time. Several programs that I do know of, yes, have actually moved some of their services from inside the building to sort of outside the building, or sort of in the parking lot sort of situation, or moving them to completely mobile. Yeah, that has certainly happened and could be a good recommendation for health departments to work with programs to make that possible, but also looking at restrictions and weighing in on changing restrictions in light of this new reality that we're in. It sounds like sites in Louisiana are making that change now, putting more supplies than usual in grab and go kits to minimize close contact, which is great. Sounds like in Western North Carolina, folks are doing drive-through services, which I love, in our Asheville parking lot, and pick up at the door services at the other location. It's great. Really just trying to minimize contact as much as possible, and and it sounds like, yes, many have suggested that their programs move outside. There's a question about an naloxone kiosk and whether that would be legal. There is a model of a program that is called Track B Exchange. It runs out of Nevada, that has both syringes that are delivered via a vending machine after registration at a storefront, and I believe you can get naloxone from there as well. As far as I know, I don't know if they have changed I don't know if they've changed their program model or their registration requirement. It used to be that you had to go to the storefront and then register, and then you could basically use the vending machines with a swipe card, like a identification card, not like a state federal, like a program identification card, and I think that would be, smart if localities or jurisdictions could adopt that. So a question over here. So in general, what are people seeing or hearing as far as changes to the drug supply, and how that might be impacting people who use drugs? Great question. I do think that, given the longevity of the potential COVID response at this point, that we should probably be anticipating some changed drug supply and really making sure that people have as much information to keep themselves and their loved ones safe as possible, as much naloxone as possible. But I do think that we should anticipate different ways of trying to work with programs and work with participants to monitor some of those things. Anyone on the call have any sense of trends in terms of drug change, drug supply issues? Okay. Yeah, so there's definitely a comment in response to that in light of this, it's actually even harder to find ways to elicit that information due to the decreased interaction with staff, or sorry, with participants. It sounds like in some jurisdictions they're getting an indication that the drug supply is generally becoming cheaper and weaker, which is interesting. Oh, great. So someone has forwarded an article from Vice about shortages of fentanyl and meth and how that's related to coronavirus. So we'll make sure that that goes out to folks on this call, where they include the information around that as within this resource. Yeah, increased street price, less availability from California, specifically related to meth and fentanyl. Certainly, there are considerations about suppliers being harder to access and dealers potentially being harder to access. Word from New York that shortages in cocaine are being felt. Mostly cocaine is being felt. At least that's what that person knows about. Interesting. So seeing some increased fentanyl in other substances that aren't labeled as fentanyl, which who knows if that is a more recent trend or a more general trend, but obviously some real fears in this time frame. Other questions or prompts to the larger group, either from NASDAQ folks or anyone else who wants to get information from the lovely people on this call? Okay, well, just as we're kind of closing up, because I know that we're a little over what most people would think, in terms of the time frame for this, we here at NASDAQ are really looking towards putting out something, some general guidance and considerations that will be informed by a lot of the content, questions, and information that were brought up today. I really appreciate everyone's participation on this call, and really am hoping to, find work with all of you who are working on the ground to find meaningful ways to try and release and loosen a lot of some of the restrictions and requirements that right now are looming over programs and standing in the way of adequate response, and really assuring that programs on the ground are supported meaningfully and in an ongoing way. So I just want to say thank you for this. I apologize for the technical issues up front, but we are going to find the best ways to synthesize all of this conversation for folks early next week, and you can be on the lookout for that. And we will add all of these resources to our NASDAQ page, and really just want to appreciate all of your work on the ground, and making sure, really just appreciate all your work on the ground, and hoping that everyone is staying as safe and well as possible. If other things that did not come up on this call, or if you have other particular information that you would like to share, feel free to email myself or anyone from this team, or our NASDAQ email. It's NASDAQ, NAS, I'll just put it in the text box. NASDAQ. Uh, anyway, so please reach out with other information, and any questions moving forward. So really looking forward to hearing from you, and we will make the recording of this and other resources available as soon as we have them ready. So thank you again. I hope you all have a lovely day, and stay well. Be safe.